Hello, everyone, and welcome. I'm Karen Gravel. I'm working for Myeloma Canada, and I'm regional manager responsible for education, but also community engagement. And I am very happy to welcome today Kathy Ganz, who is a director of stem cell at Canadian Blood Services. Actually, we've addressed a lot of information regarding blood tests, understanding your labs, so on and so forth. So Canadian Blood Services, we must always think about blood donations towards the transfusions. But actually, so what do they do with us in the myeloma world? So today she will present on the role the stem cell program and registry play in supporting patient treatment. So I'm very happy to welcome you, Kathy.
Well, thank you. And thank you so much for the invite. And lovely to see Martine's face earlier on. And we are very fortunate that we're able to connect. So hopefully it's looking normal for your viewers.
We
But
can see your
thank you.
screen. You can go ahead,
Perfect.
Kathy.
Thank you. Thank you. And thank you again so much for the invite. And the invite came to Dr. Matthew Seftel and and unfortunately, Dr. Seftel was busy, but I think this is kind of a follow-up to a presentation that he did in Vancouver. And so we're going, I'm taking the honor and the privilege of really presenting on Matthew's behalf. And just by way of, so I'm actually, by training many years ago, a medical lab technologist. And so I have a fondness of testing, but in my capacity today as director of the stem cell program, I hope to just really kind of high level identify and point out our support of each other. And so I'm hoping for the next few minutes that I will be able to do that. So we'll go over some of the overview of Canadian Blood Services, our transfusion service, which is one branch, our stem cell service, and relevance to patients with myeloma. So many may or may not know, and I don't want to presume. So Canadian Blood Services is built with four main pillars, as we call them. So we have blood for life, plasma for life, stem cell for life, and organs and tissues for life. And really, here's what it's all about, right? We ensure Canadian patients have reliable access to safe, high quality blood and blood products, including stem cells and tissues and organs that they will need. So under the blood field, or under the blood pillar, I'll call it, we collect, test, and manufacture blood and blood products, which we primarily refer to as red blood cells. You'll hear packed cells, or as some different terminologies that might be out there. Certainly platelets, which would include our apheresis platelets and platelets that are derived from whole blood. And of course, our plasma, which is also some plasma derived from whole blood, but also our standalone plasma centers. And we distribute these products to healthcare providers for the treatment of patients across Canada. And we also have the diagnostic laboratory testing services in some provinces. So depending on which province you will live in. From our plasma side, we have, and I'm not going to read all of this, but the long and the short is that we collect plasma from volunteer unpaid donors. And so folks may have heard about some of the paid donor activities in Canada, but Canadian Blood Services, it's the oversight for volunteer. And these plasma donations are then further manufactured into what we call plasma protein products. And then those plasma protein products would come back to Canadian Blood Services, where we would then distribute them to the hospital to treat patients with immune disorders such as hemophilia, and there are many, many other diseases that are treated. And so I'm sure many people are familiar, but this is what a unit of red cells would look like, a unit of platelets, and our immunoglobulins that would come in vials. The network that we have is across Canada, and I will send you this PowerPoint, and I will apologize for not sending it in advance. But this map really just shows you that we're coast to coast, with the exception of activities within Quebec, and the various sites that collect blood, plasma, platelets, along with our cord blood collection program. And so the little icons are kind of small here, but when I send this to you for sharing, you'll be able to see them better. So in our blood programs, our blood, plasma, and platelets, we have about 400,000 active blood donors that support this. And we collect in mobile clinics. Many of you may have seen, attended, been, you know, family members attend, but we have these permanent clinics, and we run mobile clinics as well. And so that map will show you the extent of that activity. From our stem cell perspective, we run a gamut of activities. We collect cord blood at 4 different locations across Canada. We cryopreserve those. We have an active part in adult stem cell donations, and run the unrelated stem cell registry. And of course, as you know, there are over 80 diseases that are treated with stem cell transplants. And you can see we have myeloma listed nicely here, but many, many others. And certainly under the blood disorder, we're seeing how this area is growing, especially in the sickle cell area. So our connections with the adult stem cell registry are partners with our collection centers and our transplant centers. So we don't perform those activities. We partner with the transplant centers across the country. And you can see, again, we cover coast to coast, with much more activity being in the Toronto and Ottawa area. But also in the Midwest, we're working to expand these services, and Vancouver is also a very active part of the country. And so when we look at the legend, you can see the different, so CH being our collection partners, and TC being our transplant. So as you can see, Saskatoon, for example, only does transplantation. They are actively stepping up their autologous collection and processing, which they do within their own hospital, but they are yet connected to doing our unrelated adult stem cell donors that are matched through the registry. And so we're partnering with them and some other hospitals that are building their transplant program in order to support them in their journey to being qualified to be an what we call an allogeneic transplant center. We'll talk some more about this in a little bit. And also, as our 4th pillar, I mentioned the organs and tissues. And so we manage the National Transplant Registry for interprovincial organ sharing. And this is an area that has really grown, and that we've taken on a much greater role within the health systems within Canada. So what does this kind of mean? No, what does this really mean for supporting patients with myeloma in needing transfusion support? So you've probably heard, and I will apologize for not being able to join you for all of your day today. I would have loved to have had insight to what your other presenters were presenting and what some of your other conversations were. So I will apologize if there's some duplication here. But really, we're talking about treating anemia in patients with myeloma. And then some of these patients, with anemia being common, will require transfusion support. And so this is one of the key elements that Canadian Blood Services offers to support your patient population. The transfusion testing, so there's kind of two parts of this. So of course we test every unit of blood for all of the transmissible disease markers, ABO, RH. We do a group and screen. Also on the other side, of course, though, if you're a recipient receiving red cells, you're going to go through a type and screen. And that's to ensure that the units that are provided to the recipients, of course, are compatible and with the aim of not having any transfusion-related activities that are undesirable. And so one of the challenges, and your previous speakers spoke a lot about the drug therapies that are available. And I don't know if he was able or covered, but one of the challenges with some of the therapies are that they do interfere with this compatibility testing. And I'll show you another slide that just highlights that. But this is another area of transfusion testing where we can support the transfusion labs in the hospitals where cross-match and would be done and the products infused. The long and the short, it's due to the CD38 on red cells. And what happens is that in the patient's serum, there are remnants of a drug that they would be on. This can cause interference in the type and screen results, giving a false positive. And with the increased use of drugs and the advanced knowledge within the transfusion medicine laboratories, there are methods that we can do that would basically absorb out the impact of the drug in the sample that the patient serum would have, and then it basically doesn't interfere with the cross match, and we can go on and ensure that we have an accurate cross match. And I'm not going to get into all of the drugs on that, though I'm happy at the end if I can support in taking away some questions or providing you some additional resources or information. So one of the things that in preparing for today that I discussed with Dr. Seftel was this is where it's really important for patients that are at risk of needing a transfusion that there is some testing done prior to the initiation of some of these drugs where possible. And it's not always possible, and we understand that. If that isn't possible, the tests that are performed by the patient testing laboratories at Canadian Blood Services, as I mentioned, can help with the interference of some of these drugs. So one of the challenges for patients that become multi-transfused, of course, is that we talk often about the ABO type and the RH, and of course, they are just two of the blood group antigens that we see on a red cell when we're doing compatibility testing. And we don't test for all of the blood groups unless there are antibodies that are developed along the way, and then we would. So there are many, many blood groups, and I highlight 47 here. And they're more common ones that we may find ourselves going down the path are antigens belonging to the Cal family or the Duffy family, the MNS family. So there are many different red cell antigens that we might have to be aware of and type and screen for. And so one of the tests that we do, or one of the things that we can do, is we'll apply or use this DTT in the test, and that is the sort of specialized testing that will help remove the effects of the drugs that you may be on. Now, in needing a stem cell transplant, so this is another area, and this is my area of love and commitment. So many blood cancers are treated with stem cell transplants, along with some of the aplastic anemia, as I mentioned earlier, sickle cell, and some of the other metabolic diseases. And really, stem cells are the hematopoietic stem cell. They're the immature cells that live in your bone marrow, and when called upon, will come out of the bone marrow and further mature into a red cell, a white cell, or a platelet. And I'm sure this group is well familiar with red cells for carrying oxygen, white cells for supporting the fighting infections, and platelets for controlling bleeds. And we just want to highlight, when we're talking about these hematopoietic stem cells, this is not the same as embryonic stem cells. And so we just want to clarify that there are two different types of stem cells, and we deal in the one. And this is the same thing, just giving you a picture of what it looks like. So in the Canadian Blood Services Stem Cell Program, so we provide stem cell products. We don't provide the products. I should clarify. We actually provide donors across Canada and internationally. And so our Canadian recipients will often need to rely on international donors as well as Canadian donors. And likewise, international recipients rely on our Canadian donors as well. So it's a very global program that we run at Canadian Blood Services. So really, we're into three main areas. We have our stem cell registry, our stem cell manufacturing, which is quite unique in that it's only offered in our Ottawa and Edmonton locations, our permanent locations, where we are supporting cryopreservation of autologous cells from 4 main hospitals, as well as allogeneic cells. Now, allogeneic cells, we don't cryopreserve on a regular basis. We saw a huge uptake during COVID when there were some challenges with access to donors, access for recipients to hospitals, and so on. So we don't cryopreserve a lot of allogeneic, and it's very unusual circumstances. And then an area that we're really starting to expand in is around the CAR T cell cryopreservation. And well, I'll talk a little bit about that later. And as mentioned, the cord blood bank. So collecting at 4 hospitals in Canada. These were selected because of their diverse populations within. And that was one of the goals of the cord blood bank, was to really build diversity. So in our stem cell registry, about 35% of potential stem cell donors are non-white, where in our cord blood bank, 65% of the cord blood units that we have stored are actually from non-white parents that were donating their cord blood. And with that program, we support a fair number, in excess of 20 researchers with cord blood units that they use as a source of stem cell in their research. And we have a very robust research ethic program that they have to go through in order to be qualified to receive some of these. And the birthing parent has to consent that their cord blood, if it's not able to be banked because it's not of quite high enough quality, would be okay to use for research. So the registry has been around for a long time, since 1988. We aim to recruit 17 to 35-year-olds that go on to kind of a waiting list, I'll call it, where we have about 464,000 waiting people, and then we require support of the 7 collection centers, and as previously mentioned, 11 transplant centers. But our donors are not just for Canadian recipients, as I mentioned. And in the last year, over 100 Canadian stem cell donors have donated for both international and Canadian patients. So a small registry by international standards, nonetheless, is really contributes globally as well as within Canada to supporting stem cell transplants. No easy feat when it looks to getting products across the country, and I'm aware that our time is running down, so I'll just go through the pictorials here, but rely on international couriers for this. Just a reference article that people can pull up. And again, just some numbers. And when I mentioned that we're part of a global, you can see that while our cord blood bank is small, it's only 10 years old. We contribute to a global inventory, as well as our donors that make up the national and international. I'll skip over these, but just to show you, these are the units that we would use to ship cord blood units, and many of our units that are distributed internationally. And part of that is because our criteria is for large units that are of high quality, meaning that they have a very high cell count and are used mostly for hard to match patients. As I mentioned, we are also actively involved with a number of pharmaceutical partners for CAR-T, and I'm not sure, and maybe when we come off, I can further talk about this, but really we collect the stem cells the way we would for any other stem cell donation. This is restricted to autologous right now. The cells go down to a pharmaceutical partner where there is a viral vector that is introduced. The cells are expanded. They're cryopreserved. And once the patient has received their chemotherapy, the cells are then infused. And the success rate on this novel treatment has expanded in many areas, and we're seeing more and more patients being treated this way. And we look forward to certainly where this area of cell therapies is growing. So I hope I was able to put some check boxes around the topics for today. And of course, I am happy to entertain questions, and I'll stop sharing my screen so I can see everyone.
Thank you so much, Kathy. Very interesting. From what I understand on your map, Quebec was graded out probably because it's being taken care of by Quebec in Quebec,
Yes,
which
yes.
would be the
Yeah, and while we say that, we partner a lot with the HEMA Quebec. We collaborate a lot. And so a lot of the reason that they're grayed out is that they're in a different financial bucket. So we receive provincial funding to support our programs, and Quebec province keep their money within the province. But we love them anyway.
I'm sure. It's not a competition. Actually, it's a great collaboration, all for patients. That's all we want. So far, we don't really have questions. I must say we've covered a lot of blood presentation so far. So that's probably the reason why. Another comment maybe you were saying that uh, donors we could have, let's say, stem cell from international too. So I'm thinking, let's say, allogenic grafts could come from, let's say, Europe, right?
Yes,
Europe
yes.
donor. Okay.
So that's around the matching, Corinne, and that is that because our registry is part of a global registry where we're accessing, 40 million pay, transplant physicians will go in and they will put in what is the HLA typing of their patient. And that triggers what we call a search. And so the search will search Canadian as well as international. And then that transplant physician is presented with the available or the matched donors. And from there, they then select based on a number of different criteria. And so the very first criteria, though, that they're going to look for is a perfect HLA match. And HLA matching is a whole other topic, and we would bring in the experts for that. And it gets quite complicated when you start looking at the matching algorithms along the way.
Hard work, I must say. Martin is our CEO
Sure.
on screen. I think you had a comment, Martin?
Yes, I want to thank you, Kathy, for your presentation and what you do, and enlightening us about the Canadian Blood Services and how myeloma patients benefit from the work and what happens to the blood that's donated, because you didn't really talk a lot about it, but IgG factors and all of those come from blood donations. And from an immune system perspective, it's very important for myeloma patients to get those blood products to boost their immune system. So I think that as a community that needs blood and blood products, it's important that we collaborate with Canadian Blood Services and that we spread the words amongst our families and friends and communities that it's important to give. You have it in you to give. So go out there and give blood because it can save a life. So we as recipients, we're very grateful, and we should do a lot more into promoting the need for blood. So.
And thanks for that, Martine. And we've shared with you previously on other calls about going to blood.ca. And there's an opportunity to share patient stories, family stories, and the resources for how you can help. And we sent you a swab kit and a campaign in a box and got your feedback on ways that we could improve that so that it is a tool that families can use. Often families want to be able to do something. And so there are some recommendations and resources there, and super easy and super valuable for friends and family to leverage. And again, your patient's stories are what are impactful for donors, and we look for those stories to share and elevate the importance. Yeah.
Great message from the heart. So thank you again to have accepted our invitation, and we hope to see you soon.
Thank you so much. Bye now.